Good evening, everybody. Thank you for joining us. As you know, COBRA met late this afternoon. All 4 UK governments received updated advice from our scientists and our chief medical officers. The outcome of the meeting is being confirmed tonight across all 4 nations, and the Prime Minister, of course, has just made a television address. I wanted to take the opportunity to set out clearly and unequivocally what this means for Scotland. Some of what I'm about to outline has already been advised in Scotland, either yesterday or today, but I want to ensure that the latest position is set out clearly and comprehensively so that you, the public, know exactly what is now being expected of you. Let me be blunt. The stringent restrictions on our normal day-to-day lives that I'm about to set out are difficult and they are unprecedented. They amount effectively to what has been described as a lockdown. I know how difficult all of that is, and I am not going to seek to sugarcoat it in any way. But these measures are essential for the protection of all of us. Coronavirus is the biggest challenge of our lifetimes, and the measures we take to tackle it must reflect the magnitude of that. These measures are essential to slow down the spread of this virus. They are essential to reduce the peak impact of it. They are essential to prevent our National Health Service being overwhelmed so that it can continue to provide treatment to all of those who need it. And they are, quite bluntly, essential to save lives. So I ask you not to think that any of this is being done lightly. It is absolutely not. This is for the protection of each and every one of us. So what I am telling people across Scotland that they now must do to help us fight this virus is stay at home. That is the clear message I gave yesterday, and I am reinforcing that message now. From tonight, the only permissible reasons to leave your home are as follows. Firstly, to shop for basic necessities, and I'm asking that you should limit that to once a day. Second, to take exercise, again, once a day, but to do so alone or with your own household, not in groups. Third, for medical reasons or to care for a vulnerable person. And fourthly, to travel to essential work if that work cannot be done at home. As I said earlier today, we will be issuing further guidance to employers to help them judge what is and is not essential. And of course, support is in place for businesses and their employees, and more, I hope, will be put in place for those who are self-employed. But apart from those restricted reasons, the advice is clear, it is strong, and it is firm. You must stay at home. To support this and to help ensure compliance, the following will now be required. Firstly, as I said earlier, all non-essential shops and retail outlets are being required to close. Libraries, communal places within parks and places of worship, with the exceptions of funerals, which I'll come back to in a moment, must close too. We will publish shortly an indicative and illustrative list of affected premises. Secondly, social events must not take place. That includes weddings and christenings. The exception is funerals, but we are asking, in what is undoubtedly the hardest thing I will say tonight, that they are restricted to immediate family only. And thirdly, gatherings of more than 2 people in public will be prohibited unless it is part of a household or related to essential, and I stress, essential work. All of this we intend to take effect immediately. And make no mistake, I know how hard this is, but I want to repeat that this is essential, and my duty to you means that I cannot shy away from telling you that and seeking your compliance. Which takes me to the issue of enforcement. As I said yesterday, I want people to think of this not as guidance or advice, but as a set of rules to be followed for the protection of yourself, your loved ones, your community, and our National Health Service. I fully expect that the vast majority of people will do the right thing, and I thank you in advance for that. However, later this week, emergency legislation will give us powers of enforcement, and we will use those powers of enforcement if that is necessary. It is no exaggeration to say that lives depend on all of us complying with these requirements. Between now and these powers being in place, if the police find people or premises flouting these rules, they will give strong advice to people to cease and do the right thing. But within days, they will be able to follow that up with enforcement, which is likely to take the form of fines. But let me be clear, I really hope and expect that the issue of enforcement will never be more than an academic one. I hope and expect that everyone will understand that complying with these rules is in the interests of all of us. I spoke a couple of days ago about the importance of all of us looking out for each other, and this is a vital part of how we do that. If we do all of these things, if all of us do all of these things, if we all agree, however difficult, to restrict our own lives for a period, then many fewer of us will die of this virus than would otherwise be the case. That means many more of us will come through this and out the other side of it, and perhaps do so more quickly, to resume the freedoms and the lifestyles that we have for so long cherished and taken for granted. I said a few days ago that this crisis was reminding us all of the fragility of life in the world we live in, but that it was also reminding us of what matters most: health, love and solidarity. So let's all do what we are being asked to do now to protect our own health and that of others, and to show love and solidarity for our fellow citizens. I now ask the Chief Medical Officer to say a few words before we take questions.
Thank you, First Minister. We have the virus in Scotland, and this is no longer a rehearsal for something that might have to happen. All of the modelling and the science has shown us that these measures can reduce the spread and reduce the impact on our NHS, but only if people comply with each and every one of these measures. When we announced previously social distancing and the measures that we've taken stepwise, there has been good compliance in some parts of the country, but much less good in others, and perhaps a lack of understanding of just how important that compliance with the measures is. The more people comply, the less impact on our NHS and the more lives that we can save. So this further increase in ask of people to reduce their contacts with anyone outside their own household to a bare minimum, except for essentials, to do with their health, to do with their ability to get food, and absolutely only essential work. These are necessary because if we don't comply with these, our impact on the NHS and the number of people who will die will be significantly increased. The enforcement that the First Minister has discussed will only be necessary if this initial discussion is not taken seriously. If the people who have up till now not had those measures introduced in their lives, who are still to some extent carrying on as normal or quite understandably believing that their work is critical, don't think again about absolutely minimising contact with others, to minimise their chances of getting the virus from others, but to minimise their chances also of passing that on to their friends, their very close family, and those in our vulnerable groups of elderly and people with medical conditions. I stress again, this is not a rehearsal. This is now real life, and lives will be lost unless everyone changes what they're doing from now on.
Thank you. Happy to take some questions. Lisa.
Sorry, yes, I just wanted to check, obviously, you've said many times that we are just at the start of this epidemic and we're expecting cases to rise. Boris Johnson said that they would review in 3 weeks these measures. What is the timescale for doing that here?
COBRA decided today that these measures will be in place as a minimum until the Easter weekend, and they will be reviewed, and we will undertake that too. But as I said when I announced the closure of schools last week, I don't want to leave people under any illusions. We will not, it's obvious that we would not try to leave measures like this in place any longer than is necessary, but I equally don't want to give people the false impression that this may only be for a matter of weeks. People should be prepared that if we are to do what is required to slow down this virus, then it may be that these restrictions are required for longer. But I think people would expect governments to keep restrictive measures like this under the kind of review that has been talked about. Any questions? Yeah.
To follow on from that last one, what do the experts tell you about how sustainable this kind of lockdown will be socially and economically? And also, if I might, could you give us a bit of an understanding of how decisions are made in COBRA at the moment? Are the devolved governments like your own essentially following UK government agreements, or is your consent for this kind of measure required?
I'll come back to that in a second. In terms of the impact of this, and all along, and you'll have heard me and others say this before, we've been anxious not to take measures earlier than we were advised was necessary. Now, that is partly based on the science, but it is also partly based on an understanding that it is harder for the public to comply with very restrictive measures like this the longer they're in place. So we didn't want to start earlier than is necessary, but it is now necessary to move to this. They will have an obvious impact on people's lives, and they are already having and will continue to have an obvious impact on the economy. That is inescapable, but it is also what makes the measures that the Chancellor has outlined and the Scottish Government has followed through here on in Scotland so important, to try to protect the economy as much as possible and to protect and safeguard the productive capacity of the economy, to safeguard jobs as far as we possibly can, in order when this crisis passes, the economy is able to recover more quickly and get back to something like normal. But we cannot, nobody can stand here and announce measures like this and say that it will not have an impact on people's lives and on the wider society and economy. In terms of the decisions at COBRA, we have been working very hard to maintain a UK approach to this, and I think rightly, because this virus does not protect the borders of the different the 4 nations of the UK, and we have done that and will continue to seek to do that, and we have collaborative discussions at COBRA where we all make our views known, and then we try to reach collective decisions. But it has also been the case, and I've made this point, I'm not sure it's always been fully understood, but I've made this point before, that we have different structures of health services, and the virus is not at the same stage of the infection curve in every part of the UK, and therefore there are times when we consider it necessary to do things perhaps slightly differently or in a different timescale. So I made the decision to ban mass gatherings slightly ahead of the rest of the UK. That was largely for a resilience reason. I thought it was important to take away the pressure that they put on our emergency services. And we announced very slightly ahead of other parts of the UK the closure of schools, again for the scientific reason but also for resilience reasons. I've set out some of what I'm saying tonight earlier today already, clearly anticipating and trying to be clear with the public about the direction of travel. But the decision making, which is informed by the 4 chief medical officers, very heavily informed by the 4 chief medical officers, is enabling us to take an approach that is common across the UK for good and understandable reasons. Yes?
Just with regards to the enforcement of this, could we end up in a situation where people have to ask for permission to leave their homes?
Well, what I'm saying right now is that I hope people will voluntarily comply with these measures, because this is not something that has been done to a population for nefarious reasons. This is about public health and the protection of all of us. It is about saving lives, and everybody must understand the importance of that. None of us can know for certain who this virus is going to hit, who is going to become seriously unwell, and who is vulnerable to dying from this virus. So none of us know that will not be us. So we're all doing this for the protection of ourselves and for our loved ones and for the wider community. So I don't want to see a situation where enforcement here is necessary, but we will have powers under the COVID emergency bill later this week. We will take the steps to ensure those powers can be used by the police if necessary, because lives do depend on compliance with this. And of course, it stands to reason, if we felt that there were other things necessary to ensure the levels of compliance to meet the objectives of these measures, we would consider doing that. But I I don't just hope, I really strongly expect that the public will do the right thing here, because I think everybody understands the reasons that they're being asked to do so. Yes.
How will these restrictions impact on, say, community groups and volunteers who are trying to go out into the community and help isolated elderly people or the homeless, for example? How can they kind of navigate that at a time when we're not supposed to be on homes?
Well, that is what I would class as essential activity. And, you know, we talked, and Catherine can say a bit more about the, in particular, the group of shielded people, those who have, you know, extreme health vulnerabilities that will have to have food and medicines delivered to them if they don't have family members or friends that can do that. So that is in the category of work that is essential. We cannot not have that done. Similarly, getting food to people more generally, keeping the lights on, and of course ensuring that people are cared for in the National Health Service and in our social care services. But people who are doing that essential work still have to follow the advice on social distancing as far as possible, follow the right public health and hygiene advice to reduce their own risk of getting the virus and then passing it on. Catherine, do you want to say a bit more about how you think that would work in practice?
Those people who are at the highest risk, who have been will be advised in the coming days about staying at home and really self-isolating for their own protection because of weakened immune systems. There's a package of care that will go with that advice to them. So both their GP locally will understand what their vulnerability is, but there's also a package of social care so that if people don't have family, don't have people who can bring them food, look after them in their own homes when they're isolating, then we will provide that care. A range of different options depending on local arrangements as to how that will be delivered. But we need to make sure that those people are not disadvantaged by this recommendation and are enabled to self-isolate for their own protection.
Okay, Alan?
Yeah, can I just ask about any discussions you might have had with Police Scotland about the enforcement aspect of this and their readiness to enforce these new rules, and in particular, as you said, they will have the power to fine people if they're flouting these rules. What conversations have you had with Police Scotland about all of this?
I had a conference call with the Chief Constable immediately after Cobra finished this afternoon, and discussed exactly how the police will conduct the efforts to make sure that there is high compliance with these. The Chief Constable's view is the same as mine. I'm not speaking for him, but I'm sure he can speak for himself, but it's the same as mine, that we will have high voluntary compliance. In the period between now and the enforcement powers being available, the police will pursue what I think he might describe as a soft enforcement approach, where if people are flouting these rules, then the police will, as they were doing with pubs over the weekend, make clear that people are flouting these rules, that it is not sensible to be doing so, and give strong advice to people that they shouldn't be doing so, and that they should, behave in the way that they are being advised to do. And, we have policing by consent and good community policing in Scotland ordinarily, so that kind of approach is one that I think will be effective. But, as I say, within days, should it be necessary, the police will have the powers and the ability to take more formal enforcement action and levy fines if that is necessary. Okay, I'll take Muir and then come back to Lisa.
Just come back to the issue of essential activity. Will you be issuing very detailed guidance as to what counts as essential, and if so, when?
I said this morning that we would, and this is, because I've had lots of questions from particularly employers. Is what I'm doing essential? Is it not? So I think we need to give a bit more guidance. Now, we will try and make that as detailed as possible, but candidly, you cannot, in a piece of guidance, account for absolutely every example and every scenario. We're trying to help people navigate through this as far as possible. And what I said this morning is that if what you do as a business is not essential, if you cannot have your staff work from home, or if you are unable to put in place safe social distancing measures, then you really shouldn't be operating and open. You should be accessing the support that is available. But I know that people in individual circumstances want a bit more help to navigate their way through that, and that is what we intend to provide over the next couple of days. Lisa.
I just wondered if I could just get an update really on where we are in terms of protective equipment and so on and so forth. I know that a lot of NHS staff are still concerned about, the kind of the ability of them to contract coronavirus because of their close proximity. So how far down the line are we from making sure that they get the right equipment that they need?
We're working really hard to make sure that the equipment is available across the NHS and it's with the staff who need it. There is guidance on what protective equipment different groups of staff need. Supplies of this equipment are globally under pressure, but we are working hard to make sure that that gets to staff. I've said before and I will say again, it really matters to me that we give our NHS workers the protection they need. My own sister was in a hospital ward this morning. She will be so again tomorrow morning. We all have, or many of us have family members in that position. They are doing an incredibly difficult job. We will never owe them more than we owe them over the next number of weeks. So I take incredibly seriously the obligation to protect them as well as we possibly can. Okay. Thank you all very much for coming along.